These drugs, these agents, CAR T cells, are quite intriguing, quite interesting from an immunological point of view, from a hematological point of view. But you have to keep in mind that it's important to select patients adequately if you don't want to run into trouble. And for instance, we know from past experience that CAR T cells work better when the tumor burden is lower. It's not, when patients do not have a big tumor mass. And there's two reasons for that. The first reason is that efficacy is better, but most importantly, side effects are also better. So when you administer CAR T cells to a patient with a big tumor burden, there's a high risk of cytokine release syndrome that could be severe and could be even fatal for the patient. So it's important to select the patient and not give these drugs to any patient you could think of. So it's important to do it this way. Because of that, because tumor burden is important, it would be ideal to use these drugs earlier rather than later. Because as I said, usually when you have a very refractory disease in third, fourth line, usually you have a lot of disease and it's quite complex to treat that disease and put that patient into remission before administering CARs. So the sooner you give them, the better results you're going to get. But this is not only for CAR T cells, this is actually for every single agent we use. The same applies to transplantation. If you do transplantation in first complete remission, the result is going to be better than when you do it in third or fourth remission. So the same applies for CAR T cells, patient selection, and again, trying to deliver those drugs earlier if you can.